Welcome to the Gum Guru podcast with Dr. Macon Singletary. I'm Jason Kong. Thank you so much. And we are going to be talking about some non-invasive treatments to smooth our wrinkles and plump up our lips, Smoothlase and Liplase. What are these and what do we need to know about that?
Well, first of all, you're going to say, what in the world is a Paradise doing this? The head and neck region is our area of expertise, and when we go to dental school, when I was at dental school at Emory, the doctors dissected the neck down. The dentists, we had to go through gross anatomy and understand what they were doing. Well, we had from the neck up, and so we got into the muscles and nerve fibers and in the head and neck region. And so the reason I got into it is because laser technology. And when I went to a seminar in Florida, the laser technology is phenomenal. And I have patients come in that have scleroderma or that have issues that they're saying, what can I do? They ask me, they see the fact that I have the Nightlase and Liplase and Smoothlase brochures. And so it's just a matter of feeling good about yourself. Beauty's in the eye of the beholder. So I never say, oh, you need Liplase. Somebody comes in and they may say, what can we do about this? It's a non-invasive way of stimulating collagen synthesis from inside. And it doesn't hurt. It may take 3 or 4 appointments, usually about 21 days apart. But what we're doing is using the laser light on the inside to stimulate collagen synthesis. It's sort of like getting Botox, but it's a natural way of doing it. And so it's like I said, it's a non-invasive way of smoothing out wrinkles along your nose. We can go up inside the cheek and a little bit under the eye and the lower lip. And then this day and age, everybody wants plump lips. I got thin lips, and I think I've had one session. I'm just to experiment, and it's interesting. I can feel it, but if I wanted to pursue it, I would do 3 or 4 more sessions. But it's inside. I don't go outside, but I stay inside, and it's the laser light energy that does the work.
That's really interesting, and the non-invasive part is appealing to scaredy cats like me. So if someone is considering this, how do they know if they're a good fit? Is everyone a candidate to have some Smoothlase done?
Yes and no. Again, it's sort of like implants. Not everybody's a candidate for implants. There are things that affect collagen synthesis that you take, medication you take. So we have to look at the medical history. People who like their alcohol, that's not a good thing for collagen synthesis. People who smoke, certain medications that will affect collagen metabolism, bone metabolism, same thing. So there are genetic issues as well. Now, I mentioned scleroderma, and that affects collagen synthesis. And we've had one case where we've done the scleroderma, and she got some results. And I think she comes back for a repeated next year. I think it will improve even further. But sometimes it takes more. Age is another factor. Younger people respond pretty quick. As we get older, it takes a little bit more sessions. Usually I add another session or 2 to my patients who are over a certain age, and just to help that along.
And for those who are a good fit and they want to proceed with either the Smoothlase or the Liplase, can you go over what a session is like and how many potential sessions there are?
Yes. So each session probably lasts about 20 minutes. And after I go over the medical history and get them to understand what we're trying to do, because it's not going to be an overnight thing. The body's got to stimulate the collagen and get that fullness effect that you have when collagen starts to synthesize. But each session takes about 20 minutes, and the laser light pulses. If I'm doing Liplase, I may use a little bit of topical on the outside, just because when I start, I don't go over the vermilion border. I stay on the red part and inside. But as you go on the outside, you feel like little pinpricks. And so I will pulse it according to the needs. Normally, I start out with 4 pulses. And if they tolerate that, I'll bump it up to 6 pulses. But I do a spot maybe 4 times, 4 pulses, and then go to another spot, and then another spot. So it does take time, like I say, 15 to 20 minutes. But that laser energy, it's a pulsing aspect of it. So it's not like a continuous sensation. And you may feel a little itch, you may feel a little prick, and some people, tolerate it. And as time goes on, they tolerate it more. And I'll go from 4 pulses to 5 pulses, and up to 6 is the most. And the distance away, the laser light's what does the work. And I'll start away, and then I'll sense how the patient's feeling. But rehydrating, taking supplements that help with collagen synthesis, zinc gluconate, folic acid, pretty much any multi-purpose vitamin, you want to have the precursors there for synthesis. But each session, about 20 minutes, and then about 21 days apart. And again, if we're doing the Liplase, I do inside the lip, upper and lower, and then I go outside. If we're doing Smoothlase, it's more up inside the cheek and down along just the cheek side. There's the 3 strikes or 3 lines that I do. Up toward the eye, then across the salivary gland, the parotid gland, and down lower. And then you just repeat it and repeat it and repeat it. So it's just a matter of repetition. And again, it depends on the person whether they immediately start getting that collagen result or growth. Depends. Sometimes, like I say, it may take. I see sometimes it happen in two visits. Some people immediately they'll feel it, but usually 2 to 3. And then if we need a 4th one, we'll get a 4th one in for them and then assess it. And all along, I take photos from the beginning. At the beginning, I take a photograph, and then at the end, sometimes in the middle, just to show them where they are, how it feels.
That's very cool as a patient to be able to see the progress visually and show you exactly what's happening. That is comforting to see. And is there any maintenance after the first few initial sessions? What do we need to know about that?
As far as maintenance, yes, you want to supplement, you want to hydrate, and alcohol is fine. It's just if you do a lot of it, you want to sort of tincture it with, be wise about it. But the main thing, most people, when they can tell me, like when I'm doing a regeneration procedure, I'll ask them, like on an implant or bone grafts or gum grafts, I say, when you cut yourself, do you heal quickly? And if they say yes, they're going to be a good candidate.
Well, that's exciting to know that these options exist. And again, it's just a matter of bringing it up to you, mentioning that you heard about this and you want some more information or want to schedule an appointment to see if you're a good fit.
Yep.
Excellent. Dr. Singletary, we can sometimes be sensitive about certain areas of our appearance. I know the jawline and underneath our chin area, those can be some sort of sensitive areas where maybe we would be very interested in Smoothlase. Does this help in that regard?
Yes, it does. I mean, you got that extra skin under the chin that as we get older develops. And, I'm sitting here sometimes doing this under my chin. My wife says, don't do that. You're going to look like you got a turkey neck or something going on. But, yeah, it will tighten up the collagen there. And number of sessions just depends on the significant amount there, but it can be done. I mean, it's one of the reasons for the treating the floor of the mouth, under the tongue. We get there at the inside the cheek, but under the tongue too. So yes, it's an area of that we can address.
And we always have an action step each episode. What would be our action step for this?
Well, like I say, beauty's in the eye of the beholder. You can ask your significant other, you say, what do you think? But it's always up to you. So if you ever have a question, are you a candidate? Is this something that's good for me? Give us a call. We'll get you in, take a quick look. The first appointment's, we talk to you, we show you, demonstrate the laser machine, which is, it's sort of cool technology. Sometimes I feel like Luke Skywalker, I got all sorts of lasers sticking around my office. But just to come in and just have a quick look, and you can always, take the information that we have, and you can also go online, and we have some videos on Liplase and Smoothlase, and we got brochures that we can hand out as well.
Wonderful. It's really impressive, the progress of technology that we've seen in your field, because it gives you a lot of tools at your disposal, and as patients it makes life a whole lot easier for us and much more easier to deal with any sort of discomfort when we have this wonderful technology, especially all these lasers at your disposal. We are out of time for this episode. Thank you so much for joining us. On behalf of Dr. Macon Singletary, I'm Jason Kong, and you've been listening to The Gum Guru.
If you would like to know more about ways to make sure your smile is healthy, or more information on any of the treatments in today's discussion, check out their website at northraleighperio.com. If you have other questions you'd like to have answered on the Gum Guru podcast, send them to contact@northraleighperio.com.